Have you ever checked your blood pressure and felt your heart sink just looking at the numbers? Many people over 50 experience this moment. They sit quietly, place the cuff around their arm, wait for the machine to beep, and then suddenly feel anxious when they see a higher reading than expected. What most people don't realize is that blood pressure is not only controlled by medication or diet, it is also strongly influenced by how we breathe. The way you breathe can either signal your body to stay in a state of tension or send a powerful message to your heart and blood vessels that it is safe to relax. In fact, research shows that certain breathing techniques can begin lowering blood pressure within minutes by calming the nervous system and relaxing blood vessels. Today, I want to share 3 simple breathing methods that many seniors find helpful for reducing tension and supporting healthier blood pressure levels. These techniques are gentle, require no equipment, and can be practiced almost anywhere. The first breathing method is slow, extended exhalation breathing. This is one of the quickest ways to calm the nervous system and reduce the pressure inside blood vessels. When we feel stressed or worried, breathing becomes shallow and fast. This signals the body's stress response to stay active. The heart beats faster, blood vessels tighten, and blood pressure rises. But when you slow your breathing and especially lengthen the exhale, you activate what doctors call the parasympathetic nervous system. This is the body's calming system. It tells the heart to slow down and the blood vessels to relax. To practice this method, sit comfortably with your back supported. Gently inhale through your nose for about 4 seconds, then slowly exhale through your mouth for about 6 seconds. Do not force the breath. Let it be smooth and comfortable. The longer exhale is what sends the strongest calming signal. Studies in cardiovascular research show that slow breathing with extended exhalation can reduce systolic blood pressure by several points within minutes by improving vagal tone and reducing vascular resistance. Many people notice that after 2 to 3 minutes of this breathing, their shoulders drop, their heart feels calmer, and their mind becomes quieter. This method is especially useful before checking blood pressure, before sleep, or during moments of stress. The second breathing method is diaphragmatic breathing, also known as belly breathing. As people age, breathing often becomes shallow and chest-focused. This type of breathing limits oxygen exchange and keeps the body in a mild state of tension. Diaphragmatic breathing encourages the diaphragm, a large muscle beneath the lungs, to move fully. When the diaphragm moves properly, it improves oxygen delivery, reduces heart rate, and supports relaxation of blood vessels. Research published in journals related to hypertension and stress physiology shows that regular diaphragmatic breathing can significantly reduce resting blood pressure and improve heart rate variability, which is a marker of cardiovascular health. To practice this technique, place one hand gently on your chest and the other on your abdomen. Inhale slowly through the nose and allow the belly to rise while keeping the chest relatively still. Then exhale gently and allow the belly to fall. The movement should feel soft and natural, not forced. Continue this pattern for several minutes. Many seniors find it helpful to close their eyes while practicing. This breathing method not only supports blood pressure, but also improves digestion and reduces anxiety. It is particularly helpful when practiced in the morning or before bed, as it sets a calm rhythm for the body. The third breathing method is rhythmic counted breathing, which combines gentle structure with relaxation. The mind and body are closely connected. When thoughts are racing or emotions feel unsettled, blood pressure often rises. Rhythmic counted breathing gives the mind something simple to focus on, which reduces mental tension and allows the body to relax. To practice this method, inhale slowly while counting to 4 in your mind, pause gently for a second, then exhale while counting to 4 again. Keep the counting calm and steady. This creates a balanced breathing rhythm that stabilizes the nervous system. Research on paced breathing shows that maintaining a steady breathing rhythm of about 5 to 6 breaths per minute can improve baroreflex sensitivity, which helps the body regulate blood pressure more effectively. This means the body becomes better at adjusting pressure naturally. Many people notice that after a few minutes of rhythmic breathing, their thoughts slow down and their body feels lighter. This method is particularly helpful during moments of worry or before medical appointments, when blood pressure readings often rise due to anxiety. It is important to understand that these breathing techniques are not instant cures for hypertension. They are supportive tools that help the body move toward a calmer state. Blood pressure is influenced by many factors, including diet, physical activity, sleep, and medication. However, breathing is unique because it directly affects the nervous system and blood vessels in real time. When practiced regularly, these techniques can improve overall cardiovascular stability. Studies show that consistent breathing exercises practiced for even 5 to 10 minutes daily can lead to modest but meaningful reductions in blood pressure over time. More importantly, they give individuals a sense of control and calm. Another benefit of these breathing methods is that they reduce the stress response. Chronic stress keeps the body in a constant state of alertness, which raises blood pressure and strains the heart. Slow breathing lowers stress hormones and allows the body to shift into repair mode. For seniors, this is especially valuable because recovery processes slow with age. Gentle breathing practices help restore balance without placing strain on joints or muscles. They can be practiced while sitting, lying down, or even standing quietly. Many people find it helpful to create a daily routine around breathing. For example, practicing slow breathing for 5 minutes after waking up can set a calm tone for the day. Practicing again before sleep can improve rest and nighttime blood pressure patterns. Some seniors also practice before meals to support digestion and reduce tension. The key is consistency rather than intensity. Just as the body responds to daily habits like walking or eating, it responds to daily breathing patterns. It is also worth mentioning that posture matters during breathing. Sitting upright with shoulders relaxed allows the lungs to expand more fully. Tight clothing around the abdomen can restrict diaphragmatic movement, so comfort is important. If dizziness occurs, breathing should be slowed and made gentler. The goal is relaxation, not effort. Over time, many people notice that these breathing practices become natural. The body begins to adopt slower, deeper breathing patterns even outside practice sessions. In closing, the body has remarkable self-regulating abilities. Sometimes it simply needs the right signals. Slow, extended exhalation breathing, diaphragmatic breathing, and rhythmic counted breathing are 3 simple methods that send powerful calming signals to the heart and blood vessels. They require no special equipment, cost nothing, and can be practiced quietly at home. While they do not replace medical care, they can support overall cardiovascular health and help the body move toward balance. With patience and regular practice, even a few minutes of mindful breathing each day can make a noticeable difference in how the body feels and responds.